Hi, my name's Colette Acker. I'm an international board-certified lactation consultant, and welcome to Holy Redeemer's prenatal breastfeeding class. Today's outline includes knowing a little bit about the benefits of breastfeeding. Many women are worried they're not going to make enough milk, so we're going to review the anatomy and physiology of the breast, but don't worry, it's very brief. I'm not going to bore you. Many women are concerned that breastfeeding is going to hurt, so we'll be discussing latch and positioning quite a bit tonight because that's the main reason for pain, is improper latch and positioning. So first I wanted to talk about the benefits of breastfeeding, and you're probably watching this because you've heard of some of the benefits, but you may not know all of them. And so there are benefits not only for the baby, but there are benefits for you as the mother, and there are benefits for our environment, and even health costs and benefits and cost to the family. So you may know that you've heard that breastfeeding is healthier for the baby, but specifically, it decreases the risk of ear infections, respiratory infections, diarrheal infections. If any of you have taken care of a sick baby before, it is no fun. If you can reduce that risk, I'd probably do anything I could. And these numbers are not small. Breastfeeding for 6 months can reduce your baby's risk of ear infections by 50% and diarrheal infections by 77%. So they're large numbers. Babies who are breastfed have a reduced risk of obesity. They have reduced risk of childhood cancers. I mean, there's some amazing things that many people don't know about. And for the mothers, you're reducing your risk of breast cancer, ovarian cancer, osteoporosis, and heart disease. So it is very good for you too. Breastfeeding your baby in the early days helps your body get back to the normal size. Your uterus contracts and reduces your risk to postpartum hemorrhage. So the benefits for you start from the very beginning. The healthcare costs are very large, not just for your family, but as a country as a whole. If everyone breastfed their baby for 6 months exclusively, we would reduce our annual healthcare costs by over $30 million. So it's a huge number. And think about how green breastfeeding is. We don't have to milk the cows. We don't have to create the formula in the factories, and we don't have to transport it to stores, and you don't have to go and purchase it. And there's very little waste. So it is green for our society, another great benefit. So now we know some of the benefits to breastfeeding, but really it's not that it's a benefit to breastfeeding, it's normal. So you're gonna create a milk that's normal for your baby. So if you look at the picture, the mother whale, she makes the perfect milk for her baby. It's super high in fat so that baby can grow really quickly and swim in freezing cold waters. The mother cow makes milk that's high in fat also because those babies have to grow very quickly. And the mother cat makes milk that's designed to help the nervous system so they can see at night and leap from trees. So our milk is designed to develop the immune system and the brain. So it's designed for your baby. Well, what the heck happened? Why aren't more people doing it? Well, in the 1940s, the use of formula became from emergent use only to regular everyday use, and part of the reason was the war. Men were going to war and women had to go to work, and we didn't have fancy breast pumps and things like that, so moms and babies were separated. What we found was that incidence of disease and illness began to rise, and so research was started. And what we found out was that formula, the science, wasn't as good as nature. So we know why we're nursing because of all the health benefits, but how the heck does it work? During puberty, mothers notice some ductal growth. Their breasts start to grow. That's your body getting ready to create milk. Then during pregnancy, you're going to have more growth. You may notice your breasts feel a little tender in the early months of pregnancy. Your breasts may get larger, your areola may get darker. These are the changes we're looking for that tell us that the body's getting ready to produce milk. So right now, you're already making milk if you've reached 4 months postpartum. And the hormones in your body are at a certain level, so the milk isn't let loose. Some people leak a little bit, and that's okay, and some don't, and that's okay too. But what is the trigger to let this milk loose? I'll tell you what it is. It's the delivery of the placenta. So after you give birth, no matter if you give birth vaginally or by C-section, it's the expulsion of the placenta that causes that hormonal change and lets the milk be available for the baby. So keep in mind that you're already making milk. It's there, and the minute that's gone, you have milk available the minute the baby's born. After that, it's really up Junior to keep up the process. So every time the baby takes out the milk, the body replenishes. The baby takes it out and the body replenishes. It's a simple economic principle of supply and demand. Here's a little look at the inside of the breast to give you an idea how it works. So that ductal growth are like those broccoli-like clusters that you're looking at. We grow more of those during puberty and pregnancy, and that's where the milk is made. So as the baby suckles at the breast, your nipples are sensitive for a reason. When the baby gets there, it sends messages to the brain to release the hormone prolactin. So the prolactin is the hormone that tells the body to make milk. So as the prolactin is released, the milk is made in those clusters called the alveoli. And as the baby continues to suckle, the body releases the hormone oxytocin. You may have heard of that one. It's the same hormone that contracts your uterus. Well, it contracts the cells around the alveoli, so it pushes the milk forward. So you need the baby in the kitchen doing its job, nursing. That sends the messages to your brain. Your body makes the milk and lets it loose. It's as simple as that. So as long as you've delivered the placenta and you've had some breast changes during pregnancy, your breasts should be able to do their job. Many women are concerned that they don't have enough milk in the first couple of days of life. The breasts don't feel full, they're not leaking, but it's the first milk that we call colostrum, and it's low in volume, but it is loaded with tons of wonderful things for your baby. So you have antibodies and all kinds of things to help the immune system, but we don't feel full. But trust it, it's good for the baby. And your baby's stomach is about the size of a marble, so it doesn't take a whole lot to fill. And it doesn't take too long to empty, so frequent feedings is what we're looking for. And remember, we do not have to fill a stomach completely to feel full. So your tablespoon or teaspoon of colostrum is plenty for the baby to feel full in the early days. Around day 3, your baby's stomach can expand to the size of a ping pong ball and accept about a half an ounce to an ounce of milk. So your body changes and the baby's stomach changes too as it takes in more food. So at around day 3 or 5, you're going to notice the supply increases. And this is what people call the milk coming in. And I don't like to use that term because it means there was nothing there beforehand. And there was. So we call it when the milk supply increases on day 3 to 5, you'll notice these changes. Your breasts are going to be fuller and heavier. When you're nursing on one side, the other side may start to leak. This is common. And you're going to hear your baby audibly swallowing at the breast. So you'll hear sort of an exhale. It sounds like ka, ka, ka. So they're just getting more volume and you can hear it. The more frequently you take milk out and the more you take out, the more milk you make. Again, simple economic principle of supply and demand, or we should say demand and supply. So nurse the baby frequently and your body will respond. So now we know why we're doing it, and we know how the body's working, and we're pretty confident we're going to make lots of milk for our baby. So what's next? Well, let's talk about latch and positioning, because again, that's a big fear for mothers. They may have heard from friends it hurts, or you're going to assume it hurts because the baby's latched onto your breast. But the number one reason for pain is improper latch and positioning. It's just the baby's not on right or they're angled incorrectly. And sometimes it can be a very quick fix. When breastfeeding hurts, some mothers say to me, I don't care if it hurts, just leave the baby there, I'm just glad the baby's on. But just think about that. If the baby's not on well, it might inhibit how much milk they get. So a good latch is not only good for your comfort, but it's good for baby too. And if it hurts, it makes breastfeeding no fun and nobody will want to do it. What do we need to do? Number one, we want to put the baby skin to skin after delivery. And that is done very well here at Holy Redeemer. All the nurses are trained, the staff is trained that this is an important process. So we lay the baby on the chest after delivery as long as both mom and baby are healthy. And the baby's gonna hang out with you for a full hour. And during that time, everything and everyone can wait. So I always tell family members or whoever your support person in the room is that you are going to hold that baby in 9 months and 1 hour because mom needs this time after delivery. A lot of fabulous things go on during skin to skin, which we'll talk about a little later. But the one thing they do is they want to eat. So within that first hour, you'll see these babies wake up, look around, and start to feed. So if you watch this baby, look how alert he is, and he's lifting his head and he's looking around and he wants to see what's going on. And you'll see him start to try to suckle his hands. See, he's shaking his head back and forth. That's a sign of rooting, and that's a sign he's looking for food. So during that hour, it's the perfect time for babies to have their first feeding. So we want to give them time. We call this self-attachment. Bottom line, your baby is wired to breastfeed. And if you lay a baby on a mother's chest and allow the baby to hang out there, they will make their way to the breast and latch on, just like any other mammal. So take the time and let the baby lead the way. And we also call this laid back breastfeeding. So it's great in the hospital setting because you're sort of leaned back in a 45-degree angle. But as you note in these pictures, the whole body should be against mom and the legs should be supported, and have the baby in the area and let them try to latch on themselves. This usually gets a very good latch. But if we can't lay around and breastfeed all day, it would be nice if we could, we want to sit up and feed our babies. We're going to go through some of the positions you may use. So number 1, bring the baby to breast level. You can use these fancy pillows, or you can just grab pillows around your house to help hold the baby in position when you're ready to start. So that's number 1. Number 2, the baby's ear, shoulder, and hip should be in one nice straight line. So breast level, straight line. And number 3, the baby's nose should be pointing towards mom's nipple. We don't want you to grab your breast and chase the baby so that your breast is in front of the baby. Let your breast go where they want to go and put the baby in front of them. So now we know those basic rules. Let's look at the different positions. This is the cradle hold, and probably if you've ever seen someone breastfeed before, they were doing this hold. The baby's head is sort of in the crook of your arm. They're in front of you. If you see in these pictures, their ear, shoulder, and hip are in one nice straight line. The mom on the top, if you notice, the baby's head is actually on her forearm. So for the baby to be positioned well, it wasn't in the crook of her arm like we may see when we're bottle feeding a baby. It's a little different. And the mom on the bottom, the baby's in the crook of the arm, but her breast kind of angled out a little bit, so it worked out perfectly for her. The cross cradle, the baby stays in the same position, but you wrap the opposite arms around them. So this baby's nursing on the left, the right arm goes around the baby, and the left hand supports the breast to help the baby latch on. And I love this in the early days because that arm wrapped around the baby reminds you to pull the baby in close, because that could be something you forget in the early days, so it's a nice reminder. This is another example of the cross cradle hold, but this mom has smaller breast size, so she needed a lot more pillows to bring her baby to her breast level. And the clutch hold, or the football hold, the baby goes at the side of the mom's body, so it's important to put these pillows behind her going up and down so there's room for the baby's butt and feet to go back. And then you need as many pillows as you can to bring the baby to breast level at the side of her body. Moms who've had C-sections may like to use this so the baby's not resting on their incision, or large-breasted moms or really tiny babies, this hold can be really helpful. And this is just an example that no matter what size breast you have, we can figure out a way to breastfeed or position your baby well so it's easy for you. Side lying is a great position to master because Breastfeeding is very difficult in the early weeks. The first 6 weeks are really hard, I'm not going to lie to you. You need lots of family support, bringing you food and drink and all that kind of stuff while you do your work. So if a baby's feeding 8 to 10 times a day, you can imagine you're doing this all day and throughout the night. It's not easy. If you could do your job lying down, I would encourage it. At first, you might need some help. So like in the afternoon, if you just want to lay down with the baby so you can rest, someone can help you get that baby latch. But once you've mastered it, it's a nice way to rest and feed the baby. And twins. So the picture on the left, the mom is nursing one baby in the football hold and the other in the cradle. And then the other mom is doing a double football hold or clutch hold. So I don't encourage all families to purchase nursing pillows, but I encourage all twin families to purchase a nursing pillow because it's very large and it allows you to have one baby on one side, get them latched while the other one is lying right next to you. So it is really helpful. So we've got the baby positioned, so now we want to get them latched. And I always say to moms, remember the hoagie. So latching the baby to the breast is similar to eating a large hoagie. We compress it, we aim it at our upper lip, we tip our heads back and open wide. And that's the same thing we want your baby to do when they're latching onto the breast. So what do? Number one, you elicit the rooting reflex. So I told you that the baby's nose should be pointed to mom's nipple. And there's a reason, seems silly, but if you tickle the baby's upper lip, the baby will tip their head back open wide and looking for food. So when they're hungry, they will open wide when you tickle around their mouth or cheeks. You want to elicit the rooting reflex, you want to wait for the wide mouth, then you want to compress your breast tissue while you pull the baby on to get a big mouthful of breast. Here, the picture on the top left, you look, the nipple's pointed right at the baby's upper lip and she is reaching up for that breast. It's exactly what we want to see, that wide mouth. And the picture on the right, also getting a wide mouth. I would probably adjust this baby's positioning a little bit and turn the baby a little closer to mom. I think I was too busy getting the picture of the wide mouth and I wasn't looking at the whole picture. And then remember the hoagie. So you see the mom compressing the breast tissue to kind of fit more in the baby's mouth. If you compress your breast tissue and your nipple goes in and disappears, then you don't do this trick, but it can be helpful for many. All right, so what are the signs of a good latch? 1, the baby has a nice wide mouthful of breast tissue. 2, the baby's lips are out like fishy lips and have rounded cheeks, and that tells me the baby's tongue is in the correct spot. We also want the chin touching the breast and the nose slightly away. So if you angle the baby correctly at the breast, they're gonna go to the breast with their chin and their nose away. That means their body is in one straight line and it's easy for them to swallow and it's easy for them to breathe. And the final thing is it shouldn't hurt. So there is a little discomfort, but I want you to know what's normal discomfort and what's not normal. So what we consider normal is what we call initial latch-on pain. That is some tenderness and discomfort in the first 30 seconds to a minute of the feeding for the first 7 to 10 days of life, which means you latch the baby on and you go, ooh, that's a little tender. And then after 30 seconds or so, you're like, okay, it's gone. And then you feel pulling and tugging, but no pinching or pain. If you have pain throughout the whole feeding, there's something wrong with the way the baby's latched. If you have excruciating latch-on pain, where you latch the baby on and you're shaking and it hurts, there's something wrong with the way the baby's going on. And again, those things can be fixed, and what you need to do is ask for help. So if you're experiencing pain that isn't what I just described as normal, please seek help and don't let anyone tell you that you just need to toughen up. All right, so when's the best time to start? As we talked about earlier, they want to nurse in that first hour after birth. So when you have that baby skin to skin, get that baby to the breast during that hour. Ask your nurse for help if necessary. During that skin to skin, there are other benefits to you and your baby. So one of them, if they get that feeding in, they tend to be very alert then, but then they sleep for about 4 hours. And when they wake up, if they've had the feeding already, they tend to remember how to do it and do it well. So it provides that feeding imprint for them. It also helps maintain baby's body temperature. So in the olden days, we used to take babies, your baby's born, and we would bring them over to a warmer and keep them warm under there. But what we found is laying them on mom's chest with a few blankets and a hat keeps them warmer than under those lights. It also decreases the risk of hypoglycemia and jaundice, and those are the two biggest reasons babies would be supplemented with formula in the hospital. So skin to skin and frequent feedings will help to decrease the risk of those. And finally, it increases bonding. When your baby is there, that skin-to-skin contact, your hormonal levels start going crazy. The prolactin and oxytocin course through your body. Those are the mothering hormones. They're the ones that make you look at your baby and go, oh my gosh, isn't this the most beautiful baby you've ever seen? Even if the kid isn't that cute, it's those hormones that make you feel that way towards your baby. It's all good. So if you feed the baby right after delivery, when is the next time you're going to do it? What you want to look for are feeding cues. So babies have all sorts of reflexes, and one of them is the rooting reflex, which you saw on that skin-to-skin video. So when the baby's sucking on their fists or looking around with open mouths, these are signals the baby's ready to eat. Some people may say, well, what about crying? I thought that meant they're hungry. But that could actually be a late sign of hunger. So you want to get to the baby when they first start thinking about food, when you're learning how to latch and getting all this down. So remember, look for those early signs of hunger. And then you offer the baby the breast every time they ask. So every time they're sucking on their fists and looking for food, you put them to the breast. I don't care if an hour has gone by or 2.5 hours. Don't watch the clock. Look at the baby and let them lead the way. Remember, their stomachs are small. It doesn't take too long to fill or empty, so feedings are frequent. Let's say your baby's sleepy. There are some sleepy babies out there. If your baby's not interested in waking up or not interested in feeding, we will teach you how to do hand expression. And you could also check out videos online to get comfortable with it before the baby's born. But bottom line, you want to put some heat on the breast, you want to do some massage, and you compress the breast in order to get milk out. And did you know your hand gets out more milk in the early days than one of those fancy breast pumps? So if your baby's not feeding, we'll do hand expression with you, get a few drops of colostrum in them, and that will keep them perky while they're learning to wake up and getting ready to feed.